To Mr. President Obama, as you begin your presidency, I believe that it is important for you to understand what we the people think is the most important difficulty you must overcome. From my point of view, and the view of many other American citizens, universal health care is the most important issue for you to deal with here in the States. Too many citizens are suffering because they are unable to pay for the necessary health coverage. Many citizens are denied access to proper health care because they are unable to afford insurance. Citizens are also unhappy with their inability to afford coverage for their families and loved ones. It is absolutely necessary that you take action and attempt to solve the problem of universal health care. Sincerely, Caleb Baechtold. President-elect Obama should implement a universal health care system that is government-supported.
Yes.
Why do you think that?
Because a lot of people actually need health care and cannot afford health care.
Because I think that there are a lot of people who can't afford health care who need it.
I just don't think that would work.
I think it would save a lot of money.
I think if we had better health, then our overall society would be better because people will be healthy.
I just believe it will help the less privileged.
I think it's important, especially for kids.
With the economy the way it is now, any help we can get as far as medical, anything like that we need.
Well, we certainly need something. I don't know if universal health care is the answer or not, but we need to provide health care for as many people as we possibly can.
If President-elect Barack Obama implement universal health care through government support, it would just help the less privileged have the opportunity to have health insurance.
Tennessee's Medicaid program will eliminate medical services for approximately up to 40,000 people. Rhode Island has even eliminated coverage for over 1,000 low-income families. And with over 7% of the population of the U.S. unemployed, the United States' top priority is to provide health care for all.
It should be our choice. If you don't want health insurance, then you don't have to pay for it. And a lot of the folks who are uninsured fall into that category. So no, I don't believe that our country is well served by going to another layer of socialism. And we already have other layers of socialism, such as Social Security itself.
Statistics are staggering. If you look at the costs to our society of the uninsured individuals in our society, there are 43 million uninsured Americans. 10 million Americans go without prescriptions, needed prescriptions for diseases like diabetes or hypertension every year. So the costs of being uninsured in our country are very high.
Well, there are people who are afraid of universal health care because they believe it's going to be this totally government-controlled program, which then, if government's controlling anything, that means there's more money spent, which explodes and it increases the deficit. But what we have to realize is that without health care, those people who are uninsured, we're all paying.
Everybody has to be covered. I mean, you can't leave people out. It's all or none. The system we have now, which is totally based on free market with some regulation, leaves a lot of people out, and there is a large gap between those who have a really good plan and those who don't.
I challenge you to listen as you will challenge me to listen. I challenge you to compromise as you will challenge me to compromise. And I challenge you to make a difference and improve our health care system as you expect Senator Baucus and me to make a difference.
If it clearly means that the federal government is going to be responsible for every aspect of every person's health care from the time they're conceived until the time they die, it's going to be an incredibly expensive program of federal government. It's going to take over something like a sixth of the entire United States economy, which is billions and billions of dollars. If that happens, undoubtedly, as has happened in other countries, the quality of health care will actually go down. It's true more people would have access to it, but typically when there's a one-payer system, the quality goes down.
Patients can have crippling or very severe illnesses, torn cartilages in the knee, arthritis in the hip. They might need something like a hip replacement. If they have no insurance, the chances of getting any other provider, whether it's the device manufacturer who supplies the implant, whether it's the hospital where you're going to have the surgery done, to actually help you provide service to this patient is very low.
Obviously, taxes will be raised. And boy, anytime you raise taxes, you hurt the economy because businesses can't grow, folks can't consume as much, you don't buy as much, so the economy is always hurt when you raise taxes, but especially in this time, you don't want to be raising taxes because of the extreme recession that we're in.
I'm fortunate that I have health insurance, that I'm able to make some decisions about the care that I'm going to get that improves the quality of my life and the quality of life of my family. But what about for the people that don't have that? Are they able to have a quality of life that is going to make them more productive in society, which means if they're productive, they're working, they're paying taxes, which then improves the economy. So you can't just look at one part of what this means. It all interrelates.
You know, it's going to be a sacrifice from certain groups of people. You know, when you make something universal, you know, some of those folks that are going to be the greatest beneficiaries are maybe the folks that would otherwise not get coverage or maybe are paying a high price for it. They're going to be happy, and then you've got other folks that may be getting Cadillac coverage of some sort, and maybe that's going to be diminished a little bit, or something like is going to change for them that they're not going to like.
Again, if he doesn't make it mandatory, it will become such that that everybody will drop their insurance to join it because it will be government subsidized. In other words, it's a handout. So more people will drop what they already have to rush into that because hello, Paul is paying for Peter. You know, it's that back that thing. So what I would strongly urge him to do is to make sure that there are certain criteria that you must have to enter into that program.
In the emergency room, typically, even if you're uninsured, it's much easier to obtain treatment. That's one of the reasons why the emergency rooms in this country are overburdened. Uninsured Americans have realized that if you go to the emergency room for a problem, you're much more likely to have it taken care of.
With all the problems that Americans are facing, more and more families are being denied the right to health care. This issue needs to be taken off the back burner and into the forefront of the U.S. government's agenda.